Good afternoon, viewers from wherever you are, whether in Kenya, Sub-Sahara, or in the United States of America, or to the far east of Asia. This is the Spot On TV show where we talk about health and relationship. And as usual, my name is Dr. Eli, and I'm here with Marianne. And today, being a special edition, we have a few ladies who will be joining us. With us is Stacy, and it's a lady that I've interacted with for long, and she knows much about breast cancer. And today we're going to have an open discussion today on this topic. I'm just wondering, did you know that 2.3 million women have been diagnosed with breast cancer? And in Africa only, we're talking about 316,000 women. This being October, we describe it as a pink October, meaning that we talk about our breast cancer awareness month. We've decided as Spot On TV to create awareness on breast cancer. So I'll start with you, Marianne. When you hear about breast cancer, what comes in your mind?
Tragedy.
Tragedy.
Yeah.
Okay, tell me.
Yeah, because definitely there is an atmosphere of burdenship. Yeah. Because it's an illness, and we know it costs a lot, the treatment and all. Yeah.
Yeah, so many people, whenever they hear about cancer in general, there's that element of fear. Like Marianne is putting it, tragedy. We'll find out by the end of this discussion if breast cancer is really tragedy. Should we consider it a tragedy? But to Stacy, when you talk about breast cancer, whenever you hear someone has cancer of the breast, what comes into your mind?
The word itself is it creates fear, and every time we hear cancer, not even breast cancer, cancer in general, it creates fear, and to even think you could wake up one day and be in such a situation, or a family member. And we mostly associate it with poverty.
Yeah.
Because it could drain your bank accounts from 100 to 0 in a very short period of while. The person in that situation, or even you as a family or friends, you always think one day you could wake up and find this person is not there. Yeah. It's we all know that it is not a guarantee that one could get out of it. So you think of cancer, you think of poverty, you think of death, and it just brings chaos in your mind, fear.
Yeah, so as you can hear, those who are in the medical field, you have a work to do. You have a work to go out and talk to people about cancer. Because many people now fear any sort of cancer. When they hear about breast cancer, women out here are traumatized. People are saying, I pray God let me never get breast cancer. Because if we get breast cancer, it's like a death sentence. People are thinking of poverty. The moment you get breast cancer, the treatment that is needed out there, the pain that someone goes through, the stigma that people have gone through. Sometimes you're forced to do a mastectomy. So the stigma that as a woman I'll have to live with either one breast or no breast at all, and that stigma. So whenever they hear the word cancer, it's fear. But I hope by the end of this discussion also we'll have to differentiate between breast cancer and just other lumps, because most of the time people, whenever they even have a small lump, they start fearing, thinking it's cancer, when in reality there could be other things. So from what you hear out there, what, I know you have friends, you have ladies you interact with. You know, I also miss them in the hospital each and every time. And what do people say as they feel in their breast that maybe could make them be scared they could be having cancer? What are some of the symptoms that you've heard from your friends out there?
Not even friends.
Yeah.
Myself.
Even yourselves, yeah, even yourselves, yeah, for sure.
There was a time,
Yeah,
and this is a real life. It's not a story.
yeah,
Story is a jabber.
yeah. Yeah, open up. We need to open up this October. Yeah, sure.
Yeah. So
Okay.
I was showering, and as I shower, I just felt something. Now the lamp.
Yeah.
And it hit me because I think earlier on I was listening to I think it was a podcast and they were talking about signs of cancer. And when when I touched myself and I was like, God, I have it.
Yeah.
I have. Yeah. And funny enough, I called my mom.
Yeah.
I started crying.
Oh my God.
I started crying.
All right.
I told her, Mom, it's over. It's over. And she was like, okay, calm down. What have you been talking about?
Yeah.
I told her, I have a lump in my breast and I think I have cancer. Now prepare because
you're gone.
Yeah.
Your only daughter is gone.
She was like, relax.
Yeah.
It can be something else. Maybe it's your menstruals, they are coming or something.
Yeah.
And I was like, fine, let's just take it as a 50-50 chance.
Yeah.
But so those assumptions, they're there.
Yeah, for sure. Okay. Any experience from you or something you've heard about symptoms?
The most common I've had is when you feel lumps growing in your breast, but we all know it could be cancerous or not cancerous. It's a possibility. It happened to my sister actually. So one time I wasn't at home and mom calls me and she's crying. Why are you crying? And you know your sister. And she feels like the lumps in her breast really and all that. And I was like, okay, but you know it's a possibility, but it could also be just something else.
Okay.
Yeah, so by that is the most common one people talk of when there is swelling and redness and I don't know.
What did you say? Any?
Swelling and redness.
Redness, okay.
Yes.
Okay.
And then some people say the nipples, the area around the nipples become more darker. I don't know, I'm not sure. It's just some of them I've had, but the lumps growing in the breast, the most common I've had. I've interacted a bit with my sister, but then she went to the hospital and it was something else. It wasn't a big deal. Yes.
Yeah, so at this point, as a professional, I like to let those who are listening or watching right now to know some of the breast cancer symptoms. Because everyone has a story. Someone will tell you that my breast was very painful, so I started getting worried. But let me tell you that what makes many women worried is usually the presence of a lump. Just like you said, the moment you feel a lump in your breast, that's it, it's cancer. But from our experience in the hospital, we've interacted with so many women who have had lumps. I will say this again, and I will say it. Do not ignore any lump. Go have an ultrasound done or a mammogram to check it. However, not all lumps turn out to be cancerous. We have breast lumps. Of course, if you have a breast lump, it could be cancerous. That I agree. But most of the breast lumps turn out to be benign or non-cancerous, especially for younger people like you, young people who are within child producing, bearing age. Lumps are common, and some of the lumps, for example, there's a lump called fibroadenoma, which is a simple breast benign lump. They never turn into cancerous. Sometimes when they're so big, we remove them because if we leave them for a long period of time, they also tend to, some of them might turn into cancer, but rarely such lumps, fibroadenoma, turn into cancer. We also have breast cysts. These ones are fluid-filled sacs that come to the breast. These ones are very painful and sometimes it gives you a lot of worry. You think, it is now cancer, but sometimes when you come for a checkup in the hospital and you end up you end up realizing it's a benign mass, it's just a lump, a simple cystic lump that will go away after some time, or you're given medication to clear them. But the following are things to watch out for women who are watching this. By the way, I don't know if you're aware, even men can get breast cancer. It is rare, but even men get breast cancer. But women have a higher chance, almost 90% higher chance of getting breast cancer than men. So the following are the things to check. Check for any breast lumps. When you feel a breast lump, don't ignore. It's good to have it checked and have a peace of mind. Number 2, pain. Pain can be within the breast itself, and this is pain that lasts even beyond your menses, because there's that tenderness that comes during menses. There's that tenderness that comes during certain time of your cycle. But this is pain that is there for almost continuously and on off, but almost there all the time. Do not ignore that pain for a long period of time. Just go and get it checked. Why am I having pain like this? Especially if you have a pain and also have a lump at the same time. Then also check under your armpits, what we call the axillary area. If there's any swellings, we call them swollen lymph nodes. Check if there's any swellings under the armpit. Try to palpate, just simply to touch. And that's what one of the ways we do diagnosis of cancer is what we call palpation. You palpate, you touch, physical examination to see if there's any mass that is under the armpit, and most of the time it's a lymph nodes, and those lymph nodes can be very painful. Okay, swollen lymph nodes that are very painful. Now, the following also you should be very careful, and that's why I stopped you at some point. You mentioned something very important: change in the breast color. It can become redness of the breast. It becomes red, or something we also call dimpling. Dimpling is like, when you have dimples, like, yeah, when your breast start, some areas like they're trying to get in to make dimples. Be very careful about that. There's something called puckering, dimpling, change of size. All of a sudden your breast becomes big when it's usually a small breast or a sizable breast. All of a sudden it's becoming bigger and lumpy. And there's change of size, color, and shape of the breast. And also there's that redness of the breast. It's time to check. Also, if your nipple are inverted nipples, normally normal nipple stands out, like it's pointed outward. If your nipple is getting inwards, okay, it's moving inwards instead of being pointed outwards, or the nipple is becoming flat, it's time you check. That is a sign for you to check whether you could be having something. It could be because of any other masses, but it could also be because of cancer. So you need to check that one. The last one is discharge, breast discharge. These are discharge that comes other than when you are on your periods, or when you are breastfeeding, or when you are pregnant. Those are the only situations where you're supposed to have a breast discharge. But if you have a discharge, go and check. Remember, having a breast discharge is not a sign, it's not a confirmation of breast cancer, but a sign that you should go and check your breast. It also could be something called ductal ectasia, that is an infection of the ductal system. By the way, most of the breast cancer mostly start from the ducts, and we'll talk about that one later on when we get to the stages of breast cancer. But this starts from the ducts. So when you're having a discharge and it's a painful discharge, do not ignore. So I don't know if you guys have a question up to there, or we move on. If you have a question up to the signs and symptoms of breast. Wasiwasi imepungua. Because most of them, a woman just have a small lump, you're like, oh my God, that is it, I'm done. The fear, the stigma, some don't even want to go to the hospital to check, because what if it is what if in a question in one, what if it's confirmed to be cancer? I'm done. So at least,
Yeah.
maybe in another forum I'll ask you, or somewhere else, I'll ask you what became of your sister or you. That is private, so what happened. But every family for sure, and I know you have friends who tell you that that is the fear of every woman, a lump in their breast. Okay, so apart from that, let me ask you, what happened or what happens? Maybe you might know what happens whenever you people have a lump. What do? You usually go to the hospital, usually Google. What do you do?
Google doctor. Doctor Google number one before you go to the hospital.
Yeah.
You've already visited Google Hospital.
And what does Google Hospital say?
Okay, so personally, I've never been in a situation where I had to Google about breast cancer.
Okay.
So I didn't have like much information about it. But I'm assuming in a normal scenario, before I even, because if it's at night, I'm not going to the hospital at night. So I would definitely go to Google first. And Google what are the symptoms and all that. And then now think about it, get depressed a little bit, then I can go to the hospital.
And let me ask, have you ever had a scenario where you had a breast pain or tenderness that makes you worried for a week or two, and after that it disappears?
Yeah.
But when you Google, what did you say?
It definitely gives you different symptoms. It can be this, it can be that, and you choose the best one and be like,
You're hoping for the best. You're different because many people always overthink, go for the worst case scenario. Yes.
No, I go for the least. I'm like,
positive minded. Because many people are not positive minded. A small Google and wanashakuja kustudy and they come and disturb us with Dr. Google. What the Google is saying. If you tell them something different, they don't want to hear that. Google have said, if I have a breast mass, I'm feeling this and this, definitely this is cancer. You want us to confirm to you, yet you don't also want us to confirm to you. So that is what exactly Dr. Google does. But we are trying our best to enlighten people, to educate people that if we have certain signs and symptoms, it's good to go to the hospital and confirm instead of allowing Dr. Google to do everything. Let me ask, majority of people that you know, because I know you know people who have had cancer, majority of people that you know who have cancer, what group do they fall under? Are they women of older age or younger age, or are they poor? Are they rich? Because someone here I had say that when you have cancer, I have cancer, what comes next is poverty. So tell me, have you interacted with people with breast cancer by then?
I mean, not really, not any close
Relatives,
relative or friend, but we other cases where you see, and they even travel to India for treatment and all that. And I mean, some make it, some don't, but yeah. I've not interacted with any case of breast cancer from a close relative or friend.
How about you?
Okay, I think I've interacted with a few, and most of them were in the age gap of 30 to 45. But I think also when it comes to cancer, it doesn't choose who is who. Anyone can be a victim, either a child, a young woman, an old woman. And also, I don't think it's decided on poverty. Because again, I normally hear that lifestyle also bring about cancer. I don't know if that's true also. So, yeah.
Okay, so what I wanted you actually to understand, because this has become a myth, in order to clear the myth that breast cancer maybe is found within people in certain social category class. But I want to surprise you. If it's true that breast cancer is found within a certain class, then the rich will be more affected than the poor. I'll tell you why. Lifestyle you have just mentioned. The rich people have a certain lifestyle that is likely to promote breast cancer, than the poor. For example, things like shisha, we spoke about shisha another time, that can expose you to breast cancer. Smoking will increase your. These are called predisposing factors. We're not saying that if you smoke you have breast cancer if you do, but you call them predisposing. They are likely to dispose you to breast cancer or other types of cancer. the things that increases the chances. So we have smoking, we have alcohol, consumption of alcohol increases chances, but the others which are not influenced by your lifestyle, that is also age. Older women are likely to get breast cancer than younger women, especially because um, I think we should have defined cancer from the word go in our professional way. You know, people define cancer in terms of pain and experience.
Yeah.
But breast cancer is simply abnormal growth of cancer cells within the breast tissue. And mostly there are two types of cancer. Either you have lobular, starts from the lobes, or ductal cancer, which starts from the ducts, the female breast ducts, the ones that supply milk. So we have ductal cancer or lobular cancer. So whichever case, you find that older women who over years, over a period of time, they've accumulated more cells in their breast than younger women. So they're likely to develop abnormal cells and there are within the breast, abnormal breast cancer cells within their breast than younger people. So older women are likely to have breast cancer, especially ductal cancer, than younger women. Two, of course, women are likely to get breast cancer more than men. We have established that one. Three, lifestyle, alcohol, cigarette, etc. You're likely to develop breast cancer more than people who are living a simple lifestyle. So diet will affect, and those are the main predisposing factors to breast cancer. So also, in fact, the most important that you should know is that also breast cancer, you can get predisposed due to genes. We spoke about DNA the other time, and we told you the importance of DNA. Now, breast cancer causing cells can be within your lineage, inherited within your lineage. That's why routine checkup, especially if there's somebody who've ever had cancer in your family, breast cancer, either your mom, your grandmother, someone within your lineage have ever had breast cancer, you need to do regular 2 years checkup. If you had money, even yearly. If you don't have, at least every 2 years, do a breast ultrasound or a breast screening for cancer, because cancer run in families, and you're most likely to develop cancer of the breast if it's within your family. But the good thing is, if you get it in stage 0, we talk about stages later, stage 0 to stage 1, you could do a lot to avert the damage, and you will actually survive. I know many people have survived breast cancer. You will actually survive breast cancer. Ladies and gentlemen, we're taking a short break. I know you're enjoying the discussion. If you want to join us, you can comment on the comment section. And if you want to be part of this show, you can always reach us through the number that is appearing on your screen right now. Let's have a short break.